is now starting. All attendees are in listen-only mode.
Hello, everyone, and thank you for joining our webinar, How to Navigate COVID-19 Testing Program Setup. Today's speakers are Michelle Altrich, President and Clinical Laboratory Director of Viracor Eurofins, and Jeff Oliva, COVID Collection Services Specialist for Eurofins Clinical Diagnostics. I'm Genevieve Randall, and I'll be moderating today's webinar. Before we begin, I have a few notes about today's webinar. The broadcast is being recorded, and you'll receive this recording and a copy of the slides via email within 3 business days. We'll follow the presentations with a live Q&A session, during which you can submit your questions to our speakers. To submit your questions, use the GoToWebinar sidebar menu. Select the Questions tab, type in your question, and hit Enter on your keyboard. You can submit questions throughout the webinar. We'll follow up with any questions we don't get to during the Q&A session. Today's webinar will cover the following topics: current COVID-19 human collection options and modalities, what to expect from the collection services process start to finish, vetting and choosing the right provider, COVID-19 testing payment options, and applications of COVID-19 testing programs. Okay, and with that, I'm going to pass it over to Michelle to begin the presentation.
Thank you, Genevieve. And when we think about testing and how to set up a testing program for COVID, it's important that we look to the CDC for guidance on who and when to test. Some of the main considerations include people who have symptoms of COVID-19. And of course, it is always important to realize that if people are having very serious complications, they need to seek emergency medical care. Additionally, many people will be needed to be tested if they have had close contact, which is defined as being within 6 feet of somebody that has tested positive for a total of more than 15 minutes. This helps with contact tracing to follow an outbreak of COVID-19. Additionally, various jurisdictions will be asked or referred to get testing by either their healthcare provider or their local or state health department. This helps us understand how much COVID is spreading in various communities. Additionally, different employers will have to consider their testing programs that will impact both workplace health and safety. And this will be determined by not only the work being done, but the number and types of people involved in the work setting as well. There are 3 basic types of tests used for COVID-19, and they vary greatly by how they should be used. First of all, the gold standard for diagnosing the disease is the PCR test. We will go into PCR testing in more detail on subsequent slides, but overall, the PCR test detects the genomic material or the RNA from the virus. Alternatively, the virus can be detected by use of an antigen test. Antigen testing detects the protein component of the virus. Generally, these tests are less sensitive than the PCR test. Finally, the 3rd type of testing is antibody response testing. This type of testing actually evaluates your body's immune system response to a past infection, or in future, once vaccines are approved, we'll also look at your response to the vaccination. There are 2 main types of antibody testing available: IgM and IgG testing. The IgM type of antibody is the first type of antibody made after viral exposure, usually within the first 2 weeks of your body being exposed to the virus. The other type, IgG testing, is made after IgM. These types of antibodies appear towards 2 weeks after infection and are much more durable and can last months and sometimes years. although data with this type of virus suggests that some of these antibody responses may start to wane after 4 to 6 months. The other parameter to consider when doing specifically PCR testing is what sample type to use during your collection. There are two main types of sample collection, those that are mediated by healthcare providers and those that can be conducted by the patient or the employee themselves, termed self-collection. And you can see by this chart that there are differences. Healthcare providers are able to administer a broader type of specimens, including oropharyngeal, also known as throat swabs, nasopharyngeal swabs, which are the traditional swab used to diagnose respiratory diseases and are inserted fairly far up into the nasal cavity, nasal swabs, which are a shallower respiratory sample in the nostril, saliva, and then pooling can also be conducted with nasal swabs. However, with self-collection, only a nasal swab and saliva are currently available. There are various considerations to consider when selecting a specimen type. One is the age of the population you will be testing. Saliva can be difficult for the very young and the very old to collect due to the need to put the saliva into a narrow tube. Additionally, with saliva, the health of the patient may be an impediment if the patient cannot produce enough saliva for the testing. Alternatively, there are some patients that have had nasal surgery who may not be good candidates for a nasal swab sampling. Additionally, you can have coexisting medical issues in patients that will make them lean towards doing one versus another specimen type. Now we're going to talk a little more detail about what is PCR. Again, this is a gold standard for determining, diagnosing the COVID-19 virus. PCR in general is the process of copying or amplifying the DNA, or in the case of COVID-19, the RNA, for use in diagnosis. Just like cells in our bodies can copy their nucleic acid, we can also replicate DNA and RNA in the laboratory using specialized instruments. This allows us to make several billion copies of a specific piece of nucleic acid in order to scientifically analyze or detect it. This type of testing has been used for decades in forensic testing, clinical diagnostics, and scientific research. And it has allowed us to convert something that used to take days or weeks to culture and identify the pathogen, such as the virus, bacteria, or fungus. Now we can complete in a laboratory setting in a matter of hours. So some general terminology regarding PCR. The extraction phase of the PCR includes breaking apart the cellular material to expose the nucleic acid. In the case of COVID, this is RNA. And this nucleic acid is extracted from the sample type. So again, you either collect saliva or a swab, and that material would go through the extraction process. At the end of extraction, you then have your template RNA sequence that is ready for amplification. The PCR assay is always designed to target a specific area of the gene within the virus. Or in the case of many assays for COVID-19, 2 different areas of the virus were tested due to the nature and safeguard against having false negative results. The next step in PCR is to utilize specific polymerases combined with primers to do the amplification process. The polymerase is an enzyme that works to build new DNA molecules upon each amplification round. And the primer is a short section of the DNA that will target and find that complementary base pair within the virus to make the amplification process successful. During the PCR process, we have a lot of amplicon, which is that final process, a lot of copies of DNA made. This next slide really looks at that in a schematic graph. And so you start with a single molecule of the RNA, and after the first cycle, each molecule will be doubled. So from a single one, you then have two. The subsequent round, you then take those two and double both of them, so you end up with 4. Likewise then, on the third round, you would end up with 8. So you can see that each cycle you get a doubling of the number of molecules that you have. So if you start with a single molecule of the virus, after 10 cycles of PCR, you have 1,000 copies. After 20 cycles, you have over 1 million, and it goes up logarithmically from there. When you get into higher numbers of cycles, you start to run out of critical reagents to keep the reactions going. This type of technology allows us to have a very sensitive assay to detect the virus. Thank you for your attention on this part of the program.
All right, thank you, Michelle. Now we're going to pass it over to Jeff to talk about COVID-19 testing strategies and planning.
Thank you, Genevieve, and thank you, Michelle. I'm going to talk about getting the specimen collected and getting it over to the lab for that PCR testing. And I'm happy to say that as a country and as a population, we've evolved in the testing process. We've learned a lot about what works and what doesn't in specific outbreak geographies. And I'm going to give some recommendations here and some ideas for those of you who are thinking about putting a testing strategy or plan together. So you really want to consider, what are your goals with testing? Are you trying to prevent outbreaks? You're trying to get people to return to work? Are you trying to quickly identify and quarantine people? And that should be based on the pandemic status in your geography, that primary goal. You want to consider what the positivity rates are in the geography. Obviously, the higher the positivity rates, the higher chance you're going to have someone walk up or show up to work or be in a drive-through with a positive case. And that should help you also determine your testing frequency, number of population that you'd like to test. And you could consider pooling from that as well. So Michelle mentioned pooling. It's a more cost-effective way to test a large population. It's basically every individual is still tested, but because they're pooled into a single test in the laboratory, that can save significant funding for future testing. So with that, what's your community impact goal? How do you want to impact the community with the results of these tests? And then what are you going to do once they're actually tested positive or negative? What guidance will you provide around quarantining? And then, of course, contact tracing within the population. Just waiting on the slide here, sorry about that. So from a collection option standpoint, you obviously have what we've all seen on the news media with the drive-throughs. What's so attractive about those, especially in the high prevalent areas, is that it's automatically built for isolation and social distancing by keeping people in their cars. As long as they don't have healthy people in the car with them that could catch it from them, you have automatic isolation and distancing of the people that are potentially infected. From a walk-up standpoint, that's another option where socially distanced individuals can line up and walk up, obviously wearing their masks. There are different degrees of risks with each one of these approaches, so you want to consider again what the rates of positivity are in your specific community before choosing. And of course, there's home and individual testing. There are now many at-home collection kits that are either nasal or saliva. There are state-specific rules on those, but I think the option that gives you, if someone is symptomatic, they don't have to come out into public in their car or otherwise and then be tested. Genevieve, can you hit the next slide, please? An important aspect of this is separating your symptomatic and asymptomatic patients. As I mentioned, if you have a walk-up testing event and you have people who are symptomatic, potentially positive, high probability positive, showing up for a testing event and walking around others, standing around others, that could turn your testing event into a super spreader opportunity. So you want to be very considerate again of what the positivity rate is in your community. You want to plan for distancing. Of course, all appropriate CDC recommended PPE guidelines and cleaning precautions. And if the positivity rate, again, reaches above 10% based on CDC guidelines, you may want to consider strictly drive-through collection process. But you can always fall back on the self-collection now. It's a new and important option for symptomatic individuals. And that works by them opting into the program, being mailed a collection kit via FedEx with an air bill that FedExes it back to the laboratory. And what's great about that is turnaround time is about equivalent to a healthcare provider collection and then laboratory sending and receiving and reporting. Genevieve, next slide, please. Thank you. So as of March, when the pandemic really started to take off, many companies popped up to become testing partners. And some were naive to the entire healthcare system. There are environmental services companies and other consulting companies that got into the testing business. And they've been, despite their lack of what you would say is healthcare industry experience, they've been able to be successful. But as you vet and choose testing partners, you definitely want to look for experts in your selected approach, whether that's a walk-up, a drive-through, an at-home testing, self-collection. You want to make sure they have safety and insurance precautions in place, that they have legitimate experience in actually doing the testing, that they're efficient in their process. If you're running a large drive-through or a walk-up and you get behind early in the morning from an efficiency standpoint, and people are standing around, waiting around for hours at a time, especially in the walk-up environment, again, you can turn your collection into a super spreader event if you're not efficient, your partner's not efficient. Most of these companies have local staffing capabilities, so they will use local staffing companies to come in and fulfill the roles of healthcare professionals or administrative staff. But it's really important that they have information technology capabilities. Handwritten requisitions and forms can slow down the whole process in the laboratory and add time to turnaround. So you want to be sure that your partner has scheduling and reporting software. They can interface easily with the lab, and they can interface with other healthcare entities as necessary, including telemedicine companies. And of course, an important consideration is your budget. Some of these events can become very expensive, especially large drive-throughs. You can see even in this picture, the PPE, the cones, the security, the IT, the tents, all that can quickly add up. Important elements to the testing event, but also can add a lot to your budget and be expensive. Next slide, please. Sorry about the lag. So from a checklist and execution standpoint, you want to confirm who your partnership points of contact are. You'll be you'll be wanting to reach out to them frequently about setup, about how they've chosen a location that meets all the requirements as far as the ability to put through large population or small population, depending on your opportunity, that they have connectivity, security, and of course, preventive measures for to stop transmission, that they've obtained appropriate clearances from the police, from the county and the state. You can imagine it if you're running a drive-through and all of a sudden you're backed up into the local streets. If you did not reach out to the police, they may reach out to you at that point. So it's important to get them involved early. And then you must source and schedule the equipment, supplies, security staff, ongoing. You can lean on your partner for this, but it's important that they, again, recognize the methodology they've chosen with you to deploy, and that they keep up with it ongoing. Next slide, please. So from a payment standpoint, there is funding, federal funding, and state and local funding from both CMS, so Medicare will pay for appropriate testing. The HRSA CARES Act will pay for those that are uninsured to be tested. There may be some restrictions on that billing, as well as commercial insurance, that they have to be symptomatic or exposed. There's varying degrees of experience with that. It's becoming more popular as state and local governments are running low on their local budgets. They're asking the third-party payers to cover the cost. Of course, if it's an employer-sponsored testing process, then the employers will pay. And then there's always the option for the individual to pay for themselves. We're seeing this a lot in the transportation industry, to where if you want to take a cruise or get on a flight, you need to be tested prior, and that's typically paid for by the actual traveler. So there are more payment options as we move through the pandemic, and each one is dependent upon, again, what you're trying to accomplish and the frequency of testing. Genevieve? So from a reporting standpoint, the laboratories are responsible for reporting both positive and negative results. This was news to me even recently, that negative results had to be reported to the state as well as positive. And it makes sense because they're trying to calculate positivity rates and prevalence of the disease. So you do need both numbers. But the requirements also include demographic questionnaires that your collection partners must deploy. And that's regardless of whether it's a private employer-based testing or if it's a public testing. You still need to answer those demographic questions and get those to the state to do your daily reporting. Genevieve? Yeah, if you build it, they will come. Well, not necessarily when it comes to COVID testing. We've worked with some very large cities and local municipalities, and they spent tens of thousands of dollars setting up daily drive-throughs to where 2 or 3 people would come through. Very expensive, and we could probably tweak that approach to more of a walk-up approach to balance the cost and benefit to the public. But I think cost and collection does vary by volume, and these large operations, again, with multiple people, police, security, tents, generators, you name it, can get very expensive. And you want to make sure you're getting your throughput, for the expense you've laid out to provide this for the public. You definitely want them to participate. So public service announcements and marketing directly to the consumer should help you get more people through. But it does vary pretty dramatically, and you can always start small and go bigger if positivity rates increase in your community. Next slide, please.
All right, thank you, Jeff. So we're going to move into a quick polling question before we get to the Q&A session for this webinar. So I want to encourage you all to submit any questions you have using the GoToWebinar sidebar menu, but I'm going to launch the poll now. So the polling question should be up on your screen. That question is, do you want a Eurofins representative to reach out to you regarding services discussed in this webinar? And we can help you better understand your needs regarding testing or other COVID-19 risk management programs. Select your answer from the choices on your screen, and I'll leave this open for a little bit before we move into Q&A. Okay, if for some reason you're having any problems selecting an answer choice, if it's just the selection isn't working, you can just enter in your answer into the questions function of your GoToWebinar menu, and we'll get you helped there. So if you have any questions, remember you can go to the GoToWebinar sidebar menu, select that questions tab, type in your question or your answer to this polling question, and hit enter on your keyboard, and our speakers will get you an answer. Okay, I'm going to go ahead and close the polling question now. Okay, so it looks like our first question is, how are point of care tests different from others? Which should I choose?
Sure. So I think this is Michelle. I'll take that question. So with point of care test, you will have a lot of those available for either antigen or antibody testing. Much fewer are available, but there are some for PCR testing. So I think that's step one, is to consider really what the goal of testing is and what your patient population looks like. Because in general, kind of as a broad brushstroke, point of care tests are less sensitive than non-point of care tests. And so if you are screening asymptomatic people, a lot of the tests for point of care are not designed for asymptomatic patients. And so it's going to be critical that you look at the instructions for use for the point of care devices and see what patient population they are intended for, to use that as kind of your first criteria. But again, they do come in antigen testing with sometimes for antigen test, it requires you to have any negative point of care test repeated on a PCR test to make sure that that sample really was negative. And again, that's because of the different sensitivities of the different tests. So it kind of, again, goes back to what the goal of the testing is.
All right, thank you, Michelle. Our next question is, can you give an example of a situation where you'd want to use antigen testing instead of PCR testing?
So again, one of the benefits of the antigen test from a point of care device is that if you have somebody that is symptomatic and is displaying symptoms, and you can pick them up very quickly within, an hour or two, you can have that patient very quickly go under isolation and start contact tracing. So the benefit is really to find those patients or employees that have very high viral loads that can be picked up with the antigen test. But again, if it's negative, a lot of times you would have to repeat those samples on PCR testing.
All right, thank you. Okay, the next question is, does the sampling method affect the accuracy of the test results? I think this is referring to saliva versus nasal or the other options.
Good question. And so there have been publications comparing a lot of these, and we have internal data for us here at Viracor as well. and have this data has demonstrated that you can get very good comparability data when you're using a nasopharyngeal swab compared to the much shallower nasal swab. And similarly, when we tested a cohort of symptomatic patients, found very good comparability with the NP swab and a saliva collection. And so it will depend a little bit on the method, but the data from PCR specifically, we've seen that NP swab, nasal swab, and saliva are all very sufficient ways to collect the samples.
All right, thank you. Okay, our next question is, what resources are available for evaluating testing or collection options for my specific case? How do I get started?
This is Jeff. I'll get started on that, and Michelle can fill in. But there are some guidelines out there, specifically industry-specific guidelines. For example, the film industry has written guidelines. There are CDC guidelines. We're happy to talk to you and share experience and connect you with our subject matter experts on both collection and testing. But it really is dependent, as the question stated, on your specific objectives. And there are so many potential possibilities to meet your need. We'd be happy to talk to you first and then connect you to people who can answer further questions.
Yes, Jeff, I agree completely. I mean, I think it can definitely, I'm sure, be overwhelming if you're not traditionally involved in healthcare for your staff or your associates or people that might live at centers that you work at. We're definitely all learning a lot through this pandemic and definitely have resources available to help along the way.
All right, thank you both. Okay, our next question is, what's the most cost-effective test or collection method when you don't currently have positives but want a proactive program?
Yeah, I think from a collection standpoint, hosted collection still works well, or you can do at-home collection. At-home collection is still an individual test. If you're going to run a population through the testing, then I recommend, with low positivity rates, pooling. And again, pooling just means that five patients in our case with the Eurofins testing are being tested in one test vial. So that means each one is collected separately in the laboratory. They're put together into one single PCR test. And if that pool is negative, you can assume that all the people in the pool were negative. And this is where Michelle can come in. She's actually an expert in pooling, but that would be the most cost-effective way. Michelle?
Absolutely, Jeff is absolutely right. If you know that you have a very low prevalence, and that really is key to having pooling being a cost-effective option, because otherwise, if you end up with a very high positivity rate, pooling very quickly can become more expensive. And so at least, and it can vary by lab, so the process that I would describe to you is the process that we utilize here at Viracor and Eurofins, and that there would be kind of an initial charge for the pooling, and then any pools that need to be retested would have a second charge. And so you have kind of that lower price initially. And again, we keep all of the samples independent. And so if you get a positive pool, those samples can very quickly, within another 12 to 24 hours, be tested to identify which specific sample is positive, so the appropriate precautionary measures can be taken.
All right, great, thank you. Okay, our next question. As an employer, if I want to offer testing to my employees, how do I do that?
Sure, you can set up a testing process with Eurofins. We can do end-to-end with collection partners. or direct you to companies that can do that for you. But it's very straightforward. It's simply setting up an account, talking about strategy, what you want to accomplish, setting up the proper testing cadence. We are working with everything from real estate companies to meat packing plants to film production companies, as I mentioned. So we have a pretty diverse customer base for our Safer at Work program. So if you reach out to Michelle or I, we can absolutely help you with that.
Okay, thank you.
Absolutely, and I would add to what Jeff has said that, a couple things to consider is, are you offering it kind of as a benefit, or is it really critical to your process, or is your HR team going to need to manage what the results are, or is it something you're just facilitating as a benefit to your staff? Because some of those kind of broad questions will impact how the process is set up.
Okay, thank you both. Okay, so our next question is, what do I do if I get positive results? Do I have to report these somewhere?
So as Jeff mentioned, it is the responsibility of the testing laboratory to work with the local and state governments with reporting the positives and the negatives for testing. There will obviously be follow-up with any positive cases for contact tracing by various municipalities, and that kind of changes based on what state and county you're at, how they've split duties amongst different government entities. But it again, especially if it's in an employer type of a category, again, you might have some internal processes and procedures you need to undertake so that you know not only kind of what contact tracing you might have to do internally, or what areas that employee frequented to maybe do extra cleaning on. So again, depending on what the situation is, you would want to put some processes and procedures in place for positives, but the official reporting would be that responsibility of the testing lab.
All right, yeah, thank you for that clarification. So it looks like we don't have any questions left. I do have one question of my own, it's kind of a plug. How is Eurofins different from other COVID-19 testing providers?
Well, I can start with that, Jeff, and then maybe you might have some other things to add. But I think, one of the great things about being part of Eurofins is we've been able to respond to the pandemic in some very unique ways. Early on in the pandemic, we had, from a laboratory perspective, we struggled a lot with supply chain problems with various parts of testing. And because Eurofins has such a wide network and various capabilities within Eurofins, we've been able to really attack supply chain from an internal perspective and beef up our ability to do supply chain internally without needing to work with external vendors. And so really what that results in is we have a lot of duplicate pathways, which is important because as we go through potentially rising cases of testing as we enter flu season, if there are other supply chain concerns that come up, we've really safeguarded against interruptions in testing with kind of functional kind of repeat supply chain things that we can manage internally. Additionally, we have really a dynamic network of testing labs throughout the United States. So we're able to really flex our capacity and manage overflow testing as different sites may have different volumes, and really facilitate and help out the different laboratories so that we can make sure we always deliver the best turnaround time, which is critical as we continue to try and get a handle on the disease. Jeff?
Yeah, definitely, Michelle. I think you covered the majority there. I'll just say from a scientific standpoint, we're second to none. This is not a commodity type laboratory. I'm I've been in the industry a long time. I'm fairly new to Eurofins, and it's refreshing to see the scientific diligence and integrity behind what Eurofins does, as well as, it's important that you have rapid turnaround time, and that doesn't get worse when the pandemic unfortunately increases in a given geography. So they stick to their volume limits and make sure that everyone gets a rapid turnaround time. And some of the horror stories you've heard of people waiting 7 to 14 days with other laboratories, that doesn't happen at Eurofins. So very good customer service, great geographic reach, including internationally, which is important to a lot of multinational companies. We're working on several bids that are truly global, and then great turnaround time as well.
All right, thank you both. Okay, so that wraps up today's webinar. If you have any questions or you want to learn more about Eurofins, you can go to our website here. I want to remind everyone that you will receive an email that has a copy of today's slides and our recording, and that will be in your email inbox within the next 3 business days. Thank you everyone for joining, and thank you so much to our speakers for sharing your expertise with us.
Thank you all. Appreciate it.
Thanks, Genevieve and Jeff. Really enjoyed it.